How you doing? My name is Vince Bruno. I'm a nurse practitioner. I'm here to show you how to do your own infusions at home if you only have like IV infusions for one antibiotic and it's in a syringe. I'll show you what you need, the process of doing it, and that way you don't have any risks for infection because you're immunocompromised at this time. Usually this antibiotic comes in a syringe, and then your IV flushes come in little packages. Those are normal saline flushes. You're going to need probably one or two of them depending on how many ports you have in your PICC line. And this is your heparin flush. It has a yellow top on it. Usually has like 5 cc's in it. And you're going to need some gloves. Okay, usually 2 of them, because you want to wash your hands for 20 seconds. And then after that, you want to put your gloves on to be able to make sure you don't get any kind of infection from your gloves or during the process of giving yourself IV antibiotics. You're also going to get 2 caps for your PICC line insertion. Remember, with your flush and your antibiotic, you want to make sure there's no air bubbles in your syringe, okay? Okay, with the antibiotic and the flush, there's a little air bubble in this, so you want to make sure you push through and with the bottom of your hand like this, and to be able to get the little bit of top right there, and you get the air bubble out, and then you can cap it again. When you cap it, you can put a cap back on like that. So now this is ready to go. So again, with the flush also and the heparin flush, you have to take this white cap off and squeeze the air out. Now, sometimes you might get a little bit fluid out, but that's fine. Okay, so you want to make sure you get the air bubble out before you put it into your PICC line. Okay, again, always wear gloves, wash your hands for 20 seconds, and the little green caps that go on the top of it, you have to change every 2 days. Okay, I'll show you them in a minute. This is what the PICC line will look like, and that's what the green cap looks like on the top. This green cap right here, you're going to change every 2 days while you're at home. Okay, make sure that your clamp is closed right now because you're going to be preparing to give yourself the IV antibiotic. Okay? Remember, you're going to take the cap off like that. You're going to make sure to take the air out. Like that. And you're going to take the green cap off. And you're going to make sure you unclamp it. It's unclamped. You're going to take the top, put it on the blue, and you're going to turn it to the right. Remember, righty tighty, lefty loosey. You're going to give it to a slow. Now, I normally go ahead and leave the syringe on there. I'll clamp that first before taking it off. Now you can take that off. And you're going to get the flush again. With the flush, you're going to take the cap off. Make sure there's no air bubble in it. There's no air bubble. Okay, then you're going to put it on there. Twist. Unclamp again. Now on this one, I want you to go fast. I want you to go 4 times and stop 4 times. 1, 2, 3, 4. All the way in there. All the way and push hard. Push all the way in. There you go. Then again, I clamp it. Release. Go ahead and get the flush. The heparinized flush. It looks like that with the yellow cap. Again, you're going to sit there and get the air bubble out. Put that on like this. Now this one you do not have to squeeze hard or fast. You can go ahead and squeeze softly. Remember, unclamp again. Squeeze softly. Put it all in there. That keeps it from getting clotted off. Okay, clamp it again. Take that off. Again, she's going to get the green cap. Now remember, those get changed every 2 days. Okay, and the dressing is changed once a week. And you also have a holder that you can get on my website at lvlifestylechanges.com. You can have the sleeve, and you can also get this netting from us. And that is it. That's the best way to give yourself your infusion. Remember, try not to touch the top of the PICC line port that you're putting the IV antibiotics into. And if you have 2 ports, just follow the flush recommendations. You're going to take the cap off, the green cap off, put the syringe on, unclamp it, push hard 4 times, and then give a flush of the heparinized saline. So if you have 2 ports, your 1 port that you're going to use the heparinized saline on that you used with antibiotic, you're going to put 3 cc's in that one. The other one that you don't use, you're going to put 2 cc's of the heparinized saline in it after you give them the flush. Okay, if you do not understand, just watch the process over again. I also have another video for IV infusions that people put themselves at home. Just remember, the antibiotic goes in first, the flush, and then the heparinized saline. Then if you have 2 ports, you take the green cap off the other port for the PICC line, and then you give it a flush with the normal saline, and then the heparinized of the rest of the 2 cc's of the heparinized saline. Thank you very much, and good luck with your IV antibiotic infusions. If you have any questions, you can go to my website, lvlifestylechanges.com. Thank you very much, and have a great day.